The next speaker is Florencia Polite. She's a professor of clinical obstetrics and gynecology and chief of the Division of General OBGYN at Penn Medicine. During the COVID-19 pandemic, Dr. Polite created an operationalized Operation Caveat, COVID-19 Acceptance, Vaccine Education and Adoption Task Force, an intervention designed to address vaccine hesitancy among staff at Penn Medicine. And her title is Addressing Vaccine Hesitancy Among Healthcare Workers of Color. So go ahead, share your screen.
Can you guys see my screen or no?
Yes, we just need slideshow mode.
Okay, sorry, hold on one second, because I have two screens on my computer. That it converted back to my two different computers. Okay,
there we go.
Great. Thank you so much, Susan, for that wonderful introduction. I was asked to speak on addressing vaccine hesitancy among healthcare workers, which I will be talking about today. So a little bit about our roadmap. I do think we have to talk about the past influences to the present so that we can see how we got to where we are right now. We'll look a little bit about COVID infection and race, as well as COVID vaccination rates and race. And then finally, I'm looking forward to sharing with you all what Penn Medicine specifically has done to address vaccine inequities in our healthcare workers. So I consider where we are right now to be the three-headed beast of COVID-19. So the first being the fact that Black and Latinx communities are dying at 2 to 3 times the rate of white communities. And our CMO at HELP likes to say this is because of racism, not race, which we can talk about a little bit later. Decreased vaccination uptake due to mistrust, and that's the 400 years that have gotten us to where we are now. And then disparate vaccine rollout across the country. So when the vaccine was first available, not just to healthcare workers, but really to the community, how there were places where you could only get it in the suburbs and not in the city. The beauty, though, of looking at healthcare workers specifically is that we take the access completely out of the question, and we only look at people who had complete access to the vaccine, which led us in our discrepancy to realize that we really did have a lot of hesitancy. The Tuskegee Experiment of untreated syphilis has been mentioned a lot by healthcare workers who have been hesitant, as well as members of the community. And what I think is interesting about this study specifically is that I do think it is, while it is the most egregious way that we have seen in healthcare, a group of people, in my opinion, really marginalized and treated unfairly when penicillin was widely available. The study continued for another 30 years, as many of you all know. What's interesting about this is that the Tuskegee Experiment has now been used as a form of disinformation and misinformation in our communities of color. Specifically now, speaking about the Tuskegee Experiment as one where the participants were given syphilis, which we know is actually not the case at all. Instead, it was simply one where they were untreated, and we watched what happened to syphilis that does not get treated despite having a treatment available. I was vaccinated on December 16th, which was within the first week that the Pfizer vaccine was made available to healthcare workers. And I lost a lot of sleep in the weeks after that, thinking about the ways that I had heard my community would likely be not engaging in vaccine acceptance. And so I woke up one day and just wrote an op-ed about what that would mean for the Black community 5 years, 50 years down the road if we did not actually seek to engage in this particular scientific revelation. And during that first week of January, we found a real discrepancy among Penn Medicine staff in who was actually agreeing to take a vaccine. So again, this was the vaccine that was made available to all healthcare workers at any stage. So this was from physicians to medical assistants, secretaries, janitors, dietitians. It did not matter. If you were employed by Penn Medicine, you were eligible to receive the vaccine by late January, and we found a 40% discrepancy in the beginning of that. What happened on January 6th when I received the second dose of my vaccine, I will tell you, had a huge impact on healthcare workers across the country, as well as many people across the country. I like to say that healthcare workers who are Black are actually Black healthcare workers. They're Black first, and then happen to be healthcare workers. And so the way that they integrated or thought about themselves in this larger context had a lot to do with vaccine uptake, as we saw. So within the first week of January, the rates of COVID-19 deaths were not as disparate as they are now. If you look at the communities that were most affected, you had Indigenous, followed by Black communities at 140 to 170 per 100,000 deaths, compared to the white community at about 95. Whites have stayed pretty steady at 95 deaths out of 100,000, while we've seen Black, Latinx, and Indigenous communities go to 200 to 230 per 100,000. And so I thought about my role here at Penn Medicine as the chief of the division and as a Black physician, and literally became sort of a poster child for vaccination, specifically vaccination among my community and vaccination among healthcare workers of color. And so with Aaron Berman, who's the executive director of HUB, we founded an initiative called Operation Caveat, COVID-19 Acceptance, Vaccine Education, and Adoption Task Force, which was essentially a 3-part initiative aimed to address hesitancy among healthcare workers, specifically those in the dietary, environmental services or janitorial services, patient transport, and materials management, which represented groups of staff in the hospital that are more than 50% Black, and in some of those groups, even more than 70% Black. So the first was a COVID-19 Why I Decided to Get Vaccinated PDF that was included in anyone's invitation to get vaccinated. So a lot of those staff that I mentioned are actually outsourced workers from the hospital. So they're not even on the Penn Medicine email. So many of the sort of facts about the vaccine and excitement about the vaccine never actually touched those groups. They received an envelope that told them that they could get vaccinated. So with their invitation was this particular PDF of a group of Black physicians about why we decided to get vaccinated. And then at the bottom, we addressed some facts about COVID-19, since there were many rumors that were going around about the vaccine that we wanted to make sure we addressed. And then we worked with Penn Medicine's amazing PR team on a host of essentially a PowerPoint slide that was originally going just in the break rooms for the staff, so where they clock in and clock out. But the PowerPoint came along so well that we decided this is actually still on display in the hospital. And so what it is, if you stood there and watched the PowerPoint from start to finish, you would see that the Black physicians in this particular group are really overrepresented. We don't make up a large amount of the physicians at Penn Medicine, but if you were looking at this PowerPoint, you would think that, quite frankly, there are a lot of us. And so the slideshow went through individual physicians getting vaccinated, why they got vaccinated, and then again, thought to address myths and facts about the COVID-19 vaccine. So I come into the hospital, a couple times a week, and inevitably I see one of my colleagues who was part of this initiative. And finally, over the course of a week, we went to the individual huddles of staff in their normal course of their day and answered one-on-one questions that they had about the vaccine. And when I first went to Aaron Berman about this, I said, my main question is, do you think that they need to hear from physicians of color, or does it not matter? And he said, they want to hear from you guys, because some of the concerns they have, quite frankly, have to do with racism. And so they want to know, how are you all marrying your experience in medicine with what you know about the vaccine? And so we sent 2 physicians to each huddle, and at least one of those physicians had to be a person of color. And staff were allowed to ask any question that they wanted. Over the course of the week, we completed a number of huddles and then decided we wanted to be clear that we were not, moving over the line of coercion. And so we did 1 full week of huddles and then essentially settled that down, and people were simply available, physicians were available for one-on-one questions after that. We wrote up Operation Caveat in the LA Times and have basically used it as quite frankly, we think, in a different way of addressing vaccine hesitancy among healthcare workers. It was also featured in the Philadelphia Citizen about putting race at the forefront. I will tell you all, I received questions and comments from a number of physicians across the country, and their main question was, how did we actually know the discrepancy in vaccination uptake, which I sort of always laughed at, because in any healthcare system, oftentimes they know the data. The issue is people are, quite frankly, not comfortable sharing the data, because the thought is, what does that say about us? And my thought about that is discrepancies exist. The data isn't what I have an issue with. The issue is, what's the problem if we're not actually trying to address the disparity? The disparity exists. We know it exists in our healthcare systems, quite frankly, just like it exists in our community outside. And so what are we doing to actually decrease that disparity? We ended the week of Operation Caveat with the vaccine experience in the Black and Brown community at Penn Medicine, which was a panel discussion with our CMO, Neil Fishman of HUP, who really just, I would say, broke down the nuts and bolts of the vaccine to the faculty and staff at large, which is one of the first times that many of us had the opportunity to hear that. And it shaped the ways that a lot of us moved forward in terms of educating staff and patients about the vaccine. But we also talked about systemic racism and how that actually interplayed with vaccine hesitancy. There's a listening lab. The town hall that I just mentioned was also made available to patients. There's a listening lab done by one of my colleagues, Dr. Abike James, in our department, who talked about her excitement about getting the vaccine and her excitement about getting her mom vaccinated, but her sisters essentially telling her that her mom should not be a guinea pig, and what that looked like in a family of color and how they negotiated through that vaccine hesitancy. Now, I know Ben already covered some of the ways that Penn Medicine went into the community, but I'm incredibly proud of the initiatives that Penn Medicine did as a whole. I had an opportunity to participate in the Mercy Penn Medicine Community Collaborative, where I personally vaccinated 80 people in one day in the community, which was one of the most gratifying days I've had in medicine. Out of those 80 people, 70 of them were Black. One of them was my mom, who's in the corner, who I got to vaccinate as well. Many physicians of color have really taken on this vaccine hesitancy as just a part of our role as Black physicians in medicine, and have, we essentially will get a call to do a talk with a school or a community, and I send out an email to a group of folks and someone agrees to do it, because if there is the desire for education, we want to make sure that in the community we are giving them educational resources from folks who know and who have access to that information. We're using our social media platforms for good, quite frankly. Social media has been a way that we have heard a lot misinformation about the COVID-19 vaccine. And so many of us have taken to our social media platforms to address the misinformation in a very real way. So here's where we are now, right? We have Black and Hispanics dying at 2 to 3 times the rate of the white population due to COVID-19. And as recently as a few weeks ago, when we look at COVID vaccination uptake in the United States by population, we see that we are still woefully behind, with only 47% of Blacks in the United States accepting at least one dose of the COVID-19 vaccine. So I would like to leave with a few thoughts. One is, as we think about vaccination and mandation, I am pro-vaccination mandate. I do think that that's the only way we will get to herd immunity. But I will say, if you mandate, then you must educate. And I think we have to think of the ways that we actually go directly to the communities to educate. And so that may be something large like a town hall. It may be a breakout. So I've been asked to speak to, University of Pennsylvania's, undergrad laboratory folks in a smaller group setting so that they can ask questions. I've been asked to speak to the Access Center, who accepts the phone calls from my patients who want to book appointments with me. But the individual smaller groups where people are more likely to ask questions, email blasts, I think, can be very helpful if the emails are sharing factual information. But many of us, as you are aware, probably suffering from email fatigue, and some of that information may go right over the heads of folks. One-on-ones. We have been stopped in the hallway. We have little pins that say, ask me about the COVID-19 vaccine. I've been stopped by nurses to say, I want you to talk to this specific staff member prior to our vaccination mandate. I've been called by a number of people across the institution to say, this one person needs someone to be able to sort of bounce their concerns off of. And we've made ourselves available as physicians here. And then podcasts and other educational forums where we can share education really to the masses. There are, as you all know, a number of hospitals that have now instituted vaccination mandates. Where we are at Penn Medicine is, well, we're at 100% now, right? Because our vaccination mandate was effective as of September 1st with a 2-week lag. But what that doesn't show is that we did lose a number of staff members, specifically young Black staff members, to the vaccine mandate. We tried to educate ahead of time to say things like this, like it is hard to be in medicine and imagine that you're going to get hired into another healthcare system that won't eventually start a vaccination mandate, or another company that will have a vaccination mandate. But the truth about many healthcare staff workers is that their jobs are able to be done in other places, right? Like they could be, a cafeteria worker outside of the hospital system. You could be a janitor outside of the hospital system. And so what we instead tried to think about is, how do we say, but you as a healthcare worker are really not just a valued member of this community, but we're actually talking about the ways that we can stop COVID-19 as a pandemic. So looking forward, I think about decreasing the gap in a few ways. One is continuing to educate. I think that we are up against one of the largest efforts of miseducation that we've ever seen. And I think that one of the things we've seen over the last few years is that people have confused their opinions with factual information, right? We have real data about the COVID-19 vaccine and its efficacy, and we have to continue to ensure that we don't waver on what we actually know. We have to continue to administer vaccines to communities of color. Communities of color specifically have been concerned about everything from, tainted vaccines being sent to North and West Philadelphia to, this is actually a form of genocide, and actually hearing out the concerns that people have before we just lash out with our "that doesn't make sense" rhetoric. Because for a lot of people, the vaccine simply represents an extension of their lived experience. One of the most troubling things I heard from a staff member at HUP who did not get vaccinated and was terminated was that because she had worked at HUP for 15 years is why she distrusted the idea that the vaccine was started here. And that was really troubling for me, as this is the place that I fell in love with medicine. But she felt like she had seen such racism in her 15 years here that this was not a place that she could actually support an initiative like a vaccine. And so what I tried to take from that moment was, I can't deny what she's seen in 15 years. All I can do is try to tell her, well, I actually know some of the folks who've been involved in this education. I know some of the folks who were actually involved in the making of this vaccine, and I know their hearts, and I think that this is, one of the most brilliant initiatives that's happened. But it is a hard pill to swallow when it's up against her lived experience. I think we have to continue to use our social media platforms, as I mentioned, not just to post selfies of getting the vaccine and the boosters, but really to use them as a network to share factual information and to correct factually inaccurate information. There's a host of us on social media who post, the vaccine got FDA approval. The vaccine is available for children. The vaccine is recommended to pregnant women. And we literally take each other's posts and repost them so that we're not recreating the wheel, but we're sharing with our own networks what the latest and greatest is about the vaccine. And then when I, am talking to patients now, as I'm sure some of you on this line are, I have a lot of patients at this point who will say things like, you can't convince me to get the vaccine. And I tell them that that's actually not my goal or role. My point is simply to leave them with some points of information so that as they are filtering through their data, they actually know the factual information that I want them to think about. One is the idea that 96% of medical doctors in the United States are vaccinated. And I remind them that we as a group of physicians are incredibly diverse backgrounds, diverse interests, and we don't even agree on when someone should start mammograms. But those of us who have gone through high school, college, medical school, residency have actually agreed to get vaccinated. And then this discussion about the current group of people who are getting really sick being largely unvaccinated. And that may seem like a very small thing that we are all very well aware of, but I've had a number of people who've told me, oh, I just didn't know that. And, they'll say, I'm just unaware that the people in the hospital who are dying are largely unvaccinated. And so sharing the idea that 97% of new hospitalizations are among unvaccinated, 99% of deaths are to unvaccinated. That doesn't mean that we as the vaccinated won't have, 1 in 100 or 10, in 1,000 who may die. But the truth is the vast majority of people, as we know, who will die of COVID-19 are unvaccinated. That's all I wanted to share with you all today. Thank you so much. I'm happy to take some questions.
I didn't see any before. Any questions? I really don't see any. Do you have any further little comments you want to make? Because there's time if you do.
No, usually I go overtime too. I think
I know. I'm really
probably talking more quickly than usual.
All right. Oh, wait.
I got
There's a
something.
Wait, there's a question now. Okay. Thank you for your passion for educating and allowing people to ask some really real fears, concerns. Are there any insights on the best vaccine for those with intellectual disability and/or mental health issues such as schizophrenia?
So that's a great question, Gayla. I have not actually had a specific vaccine preference that I have heard for those with intellectual disability. Susan, I'm not sure if you have. I will tell you that from the specific group of patients that I deal with the most, which is women, we are more likely to advocate for the Pfizer or the Moderna vaccines, simply because in the very rare case that somebody had a blood clot from J&J, which was even less likely than a blood clot from birth control pills, we still didn't want to take that risk in our young, healthy female patient population. So for us, we have advocated pretty strongly for J&J and Moderna. I also think, the idea that you need a booster now in such a short time after J&J, we've sort of steered people away from. But I have not heard anything specific about intellectual disabilities.
Okay, thank you.